This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning. This is the Acupuncture on Air program, and today is actually our third interview in a series of shows that we're doing with Ilana Sauter from Melbourne in Australia. And in fact, now I've been looking at our stats, Ilana, and on our first show, we've got like more than 120 views on our YouTube. So we're onto a real winning combination here.
Yeah, well, what can I say? We're going viral.
Yeah,
I think we're a winning combo too, and I would love to interview you one time too, Heiko.
Yeah, that's all right. No, we can do that.
Yeah, now, today's topic it's a very unique one because it's rarely spoken about, and the metaphysical allows us to understand the underlying needs of our body and how it's communicating to us through physical signs and symptoms.
Yeah, and in particular, I think because the topic too, endometriosis and menstrual cycle pain. I mean, of course, it's common. Many women have it, so it'll be interesting just chatting with you. But just before we sort of start on that, how do you find that you are getting these patients coming to you? Are they coming to you because they've heard on the grapevine Chinese medicine can help this, or have patients heard acupuncture helps for pain, so then they think, it might help for this type of pain, or are you getting referrals from the GP specifically, for women's complaints?
Yeah, well, absolutely, Heiko. Many women come to me for gynecological issues and from various referrals. I do find most women book themselves in because they have heard from their girlfriends, having beneficial experiences with Chinese medicine, or they're just curious to try it. Perhaps it's a motivator as they would like other options other than medications and device-like interventions.
Yeah, well, that's what I'm finding is that, more and more people generally for any condition that they're trying to get away from resorting to just being stuck on medication. And, I find in my own practice, a majority of women coming to see me and they've had like a Western medical diagnosis, and it's been called, endometriosis, and it's been confirmed by laparoscopy, and they're taking anti-inflammatories to control the pain, and then they come because they want an alternative to the drugs. And so I find it a bit difficult. I need to explain to them, well, look, this is just not something to replace the drug. It actually is to improve your body, improve your health, so that you don't need any drugs. And so, and are you finding that too?
Yeah, definitely. I do find that, perhaps when people do come in, they don't exactly know, that they might think, Chinese medicine treats endometriosis, and per se it is different, isn't it? Because when a woman comes in, if her main complaint for the endometriosis is really heavy periods or period pain or pain during sex or ovulation, our treatment principle, first of all, is to address that main symptom, isn't it? The irregular cycle, the period pain, the blood stagnation or whatever. And I am trying to educate them, and it is hard. They really don't understand it. I think maybe it's our Western society, and everybody gets very symptom focused.
Yeah, and I think that's what I find is the big difference between the Western and the sort of the natural traditional Eastern approach. And I come in and I start asking questions. Do you get cold feet, or and how's your sleep? And, do you crave, cold drinks? And they said, look, don't worry about that stuff. Just fix the endometriosis.
Yeah, I know.
And I said, but look,
so
it's
true.
part of that whole thing. And I try to explain that, you might have 5 women with endometriosis, but they all have a different diagnosis from our point of view, different treatment, different needle points, different herbs. And, and this takes a bit of time to get through.
Absolutely. And, for example, I had a patient once who came in for her climax was affected. Something happened and her ability to climax was reduced. However, she also had, menorrhagia, like very heavy bleeding. So obviously, and she came to me because she was annoyed with her previous acupuncturist who kept just trying to treat the period.
Right.
So I said, okay, look, I can try and go from both avenues. And then I think she was more happy to feel as though her need was being addressed.
Yeah, well, so what I try to say is, as I said, we do some treatment that's for the symptom, if you like, and about 60% or 70% of the treatment is for the root cause of the problem. But just getting back to that cause now, why don't you just tell us, as simply as we can, causes of endometriosis according to like Chinese medicine and Chinese, metaphysical and the, emotional, mental causes. And remember, we've only got 20 minutes, Ilana, so yeah, just...
Yeah, I know, I'll try. Okay, so allow me to begin by introducing metaphysics here, which is very relevant to Chinese medicine as a holistic health system. It considers the imbalances of emotions, and in Chinese medicine, if you don't process your emotions long term, it can create physical symptoms and eventually more serious illness. And I believe illness, however mild or severe, is an indicator of your emotional state and how you're feeling, and that is caused by your thoughts and what you focus on. So first of all, if we consider why any woman would have a woman's gynecological health issue, from a metaphysical perspective, it would be said that it's a woman rejecting or not accepting an aspect of her femininity, and we talked about this in our previous interview.
Yeah.
And so with the feminine energy, perhaps not honouring or accessing it, ideally, when we're in our higher human consciousness, we can feel and choose to access the feminine or the masculine as we need. And there is even plenty of research available supporting that a woman who can access her feminine energy and be feminine produces all the good female hormones that allows her body to be healthy, and that's the same for men. Thus, regarding endometriosis, the underlying reasons for it manifest vary from insecurity, disappointment to frustration, and women with this illness may be replacing self-love with sugar, and there can be a tendency to blame rather than take responsibility.
Okay, so that sounds really, really deep, Ilana. But now, of course, now you can tell us, in terms of Chinese medicine, how we can treat that. Like say some of these issues where you say the women are not having enough self-love, or they're suppressing some kind of emotion. How can we use acupuncture and herbs to address that underlying issue? Yeah,
absolutely. Well, the acupuncture and herbs work so well because if I'm coaching a patient or just teaching them or allowing to explore these aspects of themselves, the amazing thing is Chinese medicine is a holistic, it's a complete health system. So her body can be supported in so many ways. So obviously there's the body work. If there's cold and stagnation, we can use cupping to pull it out of the body. If there's stagnant heat, we can use gua sha. That works really well. And if there's cold, moxibustion. And obviously all these, therapies help her to feel better and help her to feel more comfortable in her body. And then comes in the herbal medicine, which eases her signs and symptoms and can support her to feel calm, energized, and, just flowing and feel good again. And then when she has all this support, she can start working on processing her feelings and directing her thoughts in a positive way. And we can start to see the foundations being created for long-lasting changes.
And what I do find too is that, like when you say, they can process their feelings, is that, we might treat the liver, for, as we say, Chinese medicine, we're just treating stuck energy in the liver. And then the patient, and particularly, the women in this case, they say they start feeling more relaxed. They're not so short-tempered and irritable because, their liver energy is flowing more freely. So they didn't have to have any, I don't know, what's the word, counselling or realisation. It's just like, I just suddenly, in my head, I'm just feeling a bit better. And so that then, goes hand in hand with less period pain, which is so now the next thing
absolutely.
what I'd like to talk about is period pain. I mean, I know endometriosis, part of the pattern is period pain, but many women have period pain. Can you just tell us a bit about the different aspects of period pain and what's normal, or is period pain normal, and how you can help with that, or how Chinese medicine can treat that?
Yeah, look, you're right. Period pain is a stigma, and many women think it's the bane of being a woman and suffering every month. But it doesn't have to be like this. So for everyone listening out there, it is possible to do something about your period pain. Well, obviously, as Heiko and I discussed, acupuncture and herbs are good. So if you can find a good practitioner near you, that would be good giving that a go. So look, emotionally, I would firstly say stop cursing getting your period, because some women really hate it. And be grateful that you are a woman and you have a uterus and that it performs its function. The only reason that we have a period means that we are a woman and woman-like. And secondly, take it easy before your period and during the period. All your female hormones crash at that time, so you're not functioning at your best. And if you have a lot to do in your life, try to complete it around other times, like especially ovulation, when you've got a lot more energy and drive. And remember that women's hormones reset every month, whereas a man's reset daily. And this means that, we don't function like men, and we need a bit more flexibility in our schedule and space to ebb and flow. Make sure you rest during your period, eat warm foods and drink nourishing teas like nettle, raspberry leaf, and like Heiko always says, a bit of zhang after the period is beneficial. Minimising the hot heating stimulants like coffee, tea, alcohol, chili and chocolate, because they dry you up and they can make you more irritable. And like we know in Chinese medicine, because women menstruate every month, they have a deficiency of blood and an excess of qi. So if you have all these heating yang kind of things, they're going to make you feel worse. And lastly, enjoy the monthly flow of being a woman. You are so lucky to have such a varied life and body and experience. So just enjoy this emotional symphony that it is every month, I suppose.
Oh, that's really positive. That's fantastic, Ilana. And I'm just on that. Do you have in Melbourne or any talks that you do for people, or in your case particularly women that might want to come in? Do you have talks at your clinic, or do you go to any community centres or anything like that?
Yeah, yes, I am. I am currently creating a Femme Vital course, an online one. And I do offer online coaching, and I have some upcoming workshops too listed on my website at ilanasouter.com.
All right. Well, I'll put that website up onto the YouTube link, and then people can go straight to there and find that. So it's been really great talking to you again, Ilana, and of course our next show. I think by that stage, our first show, we should have like 500 YouTube views. We'll be going right up there for the mega. We're going to. Ken's looking at me there that we might get the big prize for the end of the year, the most YouTubes.
Oh, that's awesome.
But yeah, the next show we're going to be talking about just Chinese herbal medicine in particular in relation to women's disorders. So that should be quite interesting. Yeah, I'd love to hear
about what you know about it, because you're an esteemed herbalist and know a lot, Shang Han Lun and all that.
So I said I'll be looking really for that, because herbs is my love per se, and so
and we love Coda herbs, don't we?
Yeah. So we'll be talking about that, and then just get rid of some of these stigmas that may be associated with with Chinese herbs. So thank you so much for being on the show again.
You're welcome. Thank you for having me. It's a pleasure.
All right, and I'm just going to be finishing off with a song. Actually, and it's quite a recent song. I'm not even sure if Ken has even heard it yet, but it's a new song from Ringo Starr, and the song is called "What's My Name."
Oh my God, my mum loves Ringo Starr.
Right,
very good choice.
Yeah. And like I said, I mean, didn't know anything about it. I just had a quick look on Wikipedia or wherever you go for these things. And the song was actually written by an Australian, Colin Hay, of the sort of Men at Work fame.
Oh, cool.
I didn't realise that he's actually worked quite a lot with Ringo in the past. So, and the song's got some great harmonica on it as well. So, here it is,
cool.
and we'll see you all soon.
Okay, thanks, Heiko. Have a great day.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.